Mr. Young is recognized.
Madam Secretary, thanks for being here today. I'm going to start on a couple of words of encouragement and appreciation. First, coming from the state of Indiana, know that our delegation, our governor, and the people of our state really appreciate your consideration of allowing the Healthy Indiana plan, which covers 40,000 low-income Hoosiers, to play an important role in terms of our Medicaid expansion in our state. HIP is the first consumer-directed plan for Medicaid recipients in the country, and thank you for that. Also appreciate internally within HHS, and I know this is a priority for OMB, increasing the evaluation of existing government programs so that we're focusing more on outcomes as opposed to inputs. Would love to work with you on that evidence-based approach in the future. One of the biggest concerns related to this health care law, of course, is its impact on jobs and wages. The CBO has indicated that the Affordable Care Act will shrink the workforce by the equivalent of 2.3 million full-time jobs. Teamsters President James Hoffa has said the law, quote, destroys the foundation of the 40-hour work week that's the backbone of the American middle class. Unite Here is a union representing 265,000 casino, hotel and food service and warehouse workers. And they recently published a new report, The Irony of Obamacare, Making Income Inequality Worse. And I'd like to submit this report for the record.
Without objection.
Unite Here supported what the President calls Obamacare, but they don't anymore. The report says, quote, without smart fixes, the ACA threatens the middle class with higher premiums, loss of hours, and a shift to part-time work and less comprehensive coverage, unquote. You have indicated, as reported in the press, quote, there is absolutely no evidence, and every economist will tell you this, that there is any job loss related to the Affordable Care Act. You know, based on the growing body of evidence, including this report, have you rethought whether or not the Affordable Care Act might, in fact, adversely impact wages, hours, and jobs for, in particular, low-income Americans?
Congressman, I've had some great meetings with Governor Pence and look forward to continuing those around Healthy Indiana and the expansion. I would say that, unfortunately, the Congressional Budget Office report, I think, has been mischaracterized. It does not say that the passage of this health care law will lead to 2 million fewer jobs. It does indicate that people will have some choices that they don't have today. They won't have job lock until they get to 65, where they have health care guarantees with Medicare. They can choose to stay at home. A lot of farm families will have the choice of not having to have an off-farm job to get health insurance for the family. So there is an average that they give, and they say you could have an average number of hours worked less, or they say you could have an average number of hours worked more.
I see our time has expired. I guess we could lower the definition of full-time employment to 20 hours, giving employees more flexibility under your analysis of the CBO report. But thanks so much for entertaining my questions. I yield back.